Yeah, hi there. Good afternoon. Thanks very much for having us. Three of us here are part of the Improving Access to Cancer Nurse Specialists and Key Workers project. We'd all like to introduce ourselves.
Hi, I'm Gilly. I'm one of the cancer nurse specialists.
Hi, I'm Marion. I'm the lead cancer support worker at Southampton.
Hi, and I'm Emma, a cancer support worker. We're really excited to be shortlisted for the PENNA Awards and would like to take this opportunity to tell you more about our project.
The background to our project is that some people with cancer don't have access to a specialist cancer nurse or identified key worker when they're diagnosed. Cancer nurse specialists are recognised to play an important role in supporting people with cancer. Nurses usually meet people at diagnosis and support them through treatment, life beyond cancer and end-of-life care. As more people develop cancer and treatments are becoming more complicated, a national shortage of cancer nurse specialists is emerging. To meet growing patient needs, new models of care are being explored. One approach is to incorporate Band 4 cancer support workers into clinical nurse specialist teams. Next slide, please.
So the lack of access to specialist nurses was highlighted in the National Cancer Experience Survey. This finding was really important because it means that people living with cancer are not able to receive the support they need from the nurse specialists to promote particularly things like health and well-being during and after treatment.
Next slide, please. Our Access to Clinical Nurse Specialist and Key Worker project introduced 2 full-time Band 4 cancer support workers to work with the gastrointestinal specialist cancer nursing team at University Hospital Southampton.
So the aim of the project was to improve the experience of newly diagnosed patients to ensure that they knew how to access the clinical nurse specialist team and support they offer. We had already actually tested out cancer support workers previously, but this was a new initiative here, and the senior clinical nurse specialist and the lead cancer support worker helped the introduction of the cancer support workers to the team in a number of ways. Clinical nurse specialists were included in the recruitment process and the planning of the cancer support workers induction. Also, the nurse specialists attended joint education sessions with the cancer support workers. Okay, so the clinical nurse specialists also attended the joint education sessions with the cancer support workers, making it a real team effort. Roles within the wider clinical nurse specialist team were profiled to define new role boundaries. New approaches to needs assessment were explored and used to identify levels of self-efficacy and case complexity.
The support workers in the project may recently diagnosed patients in clinics or the oncology centre doing chemotherapy and radiotherapy treatment. We made sure patients had the clinical nurse specialist team contact details. We did holistic needs assessments and planned care based on assessment results, signposting patients to relevant support. The cancer support workers also created a database of available hospital and community support resources. A couple of examples of the support we gave to patients were referring a patient to the Cinnamon Trust, who provide care for animals when patients are in hospital or too unwell to look after their pets. Providing support to help patient build muscle mass and improve fitness through Macmillan's Move More pack after deconditioning during chemotherapy treatment.
The project found that nurse specialists and cancer support workers had very distinctive roles within the newly created team, and this enabled them to stratify their support they gave, and they all gave appropriate support, which was delivered across the whole team. Cancer nurse specialists addressed complex specialist needs, such as facilitating diagnostic tests, educating patients about their treatment, and addressing complex social needs such as people with mental illness and homelessness.
The cancer support workers were able to promote patient access to well-being by supporting behaviour change, signposting to local community support, physical activity and benefits advice. Cancer support workers also provided continuity by giving low-level emotional support to patients and their carers during their cancer care pathway.
So overall, the project enabled collaborative working between cancer support workers and nurse specialists. This approach offered cancer patients greater access to the wider CNS team and delivered a broad range of personalised care opportunities.
Evaluating the project, we found that introducing cancer support workers to the specialist nursing team resulted in a positive impact on the access to assessment and care planning, community support services, practical and financial support, and health and well-being advice. Following the introduction of the cancer support worker role, patients were more likely to report that they were given the contact details of a key worker and that the wider healthcare team worked well together.
These findings contribute to addressing the lack of access to cancer nurse specialists identified by patients in the National Cancer Patient Experience Survey.
To complete our presentation, we'd like to share a picture of the whole GI CNS team to acknowledge and thank them for their contribution to the project. Thanks very much for listening.